So let's get started with the presentation. I am Allison Kushner. I'm the ADA coordinator at the University of Michigan and director of the Disability Equity Office. Today's presentation, I didn't realize that could be a disability, substance use disorders, skin conditions, infertility, and more. So we do have a lot to cover, so we're going to go ahead and get started. In this session, I'll provide a brief overview of disability basics and definitions, highlight some medical conditions that people often don't realize can be disabilities, and explore how to provide workplace accommodations, resources, and support for employees who may have these conditions. Finally, I'll discuss some language considerations for referring to less common and historically stigmatized conditions as well. So first up are some disability basics and background. So what is the ADA? The ADA is the Americans with Disabilities Act, and it's a civil rights law that was originally passed in 1990 and then amended in 2008 to provide broad protections to individuals with disabilities in places like employment, public places, public education, etc. It also protects individuals from discrimination based on their association with an individual with a disability, or IWD, and creates an affirmative duty to provide reasonable accommodations unless doing so would create an undue burden or hardship or alter the fundamental nature of the services or operations of a place of public use or an organization's work. The legal definition of a disability under the ADA is any physical or mental impairment that substantially limits one or more major life activities. Substantially limited means that some aspect of a person's daily life or bodily functions or systems are more impacted than the general population. This can include thinking, concentrating, speaking, seeing, hearing, walking, standing. The list goes on. The ADA also covers conditions that are not currently active, but may be substantially limiting when they are active. This includes conditions that may be in remission, like cancer, or during an episodic flare of depression or anxiety. The implementing regs even list specific disabilities, which simply based on their diagnosis alone, meet the definition of a disability. But that list is not exhaustive, and it's important to remember that any medical condition, depending on impact, can be a disability under the ADA. Disability is far more common than many realize. It's actually 1 in 4 adults in the US that lives with a disability. But the unemployment rates are 4 times higher for individuals with disabilities compared to those without. And while many people imagine apparent disabilities, sometimes called visible disabilities, the reality is that 96% of people with chronic conditions live with non-apparent disabilities. Disabilities also represent the largest minority group in the United States, and uniquely, it's one minority group that any of us could join at any point in our lives. So before I move on to the next slide, take a moment and bring to mind an image of a disabled person. Perhaps many of you thought of those images in the top half of this photo right here, this picture. Someone with an apparent disability, such as someone using an assistive device or someone with a missing limb. However, most individuals living with disabilities have what we call a non-apparent disability. When we're considering how to create more disability inclusive environments, one key way to do so is remember that individuals with disabilities are everywhere in our society, our workplaces, and our classrooms, not just those that are apparent to us. This is a list of some medical conditions that frequently qualify as disabilities under the ADA, like chronic pain, cancer, bipolar disorder. It's not exhaustive and still requires individuals to have that substantial limitation. It is important to note that many of the medical conditions here move between apparent and non-apparent, depending on the exacerbation being experienced. Whether the disability is non-apparent, except when a symptom or exacerbation becomes apparent, like when someone with epilepsy has a seizure. When we think about common disabilities, many people picture what's outwardly apparent, as I mentioned earlier. But many of the conditions we're going to discuss today are less recognized or misunderstood because many of them are often non apparent. These include neurological and mental health conditions, chronic pain and fatigue, autoimmune disorders, communication processing differences, reproductive health conditions, and severe allergies. Each of these can create real barriers, even though they're not always apparent to others. So let's turn to some specific categories of conditions. First up are neurological conditions, with ADHD being one of the most common neurodevelopmental conditions, yet many people don't realize it can be considered a disability. Its symptoms, like challenges with attention, organization, and self regulation, are often misunderstood or minimized, which means the real barriers it creates in education, work, and daily life can go unrecognized. Another commonly misunderstood or stigmatized disability is Tourette syndrome. Tourette syndrome is a neurological condition that causes individuals to have involuntary movements and sounds called tics. These can range from simple actions like blinking or throat clearing to more complex behaviors. In academic and workplace settings, Tourette's may affect concentration, communication, or social interactions, making awareness and accommodations especially important. The next category of historically stigmatized and sometimes misunderstood conditions include mental health conditions. Although these conditions can significantly affect daily functioning, they're often not recognized as disabilities. This is because many of these diagnoses are stigmatized or misunderstood or seen as temporary issues rather than long term conditions that may substantially limit major life activities. For example, substance use is commonly seen as a moral failing rather than a chronic health condition. Schizophrenia is heavily stigmatized and misunderstood, often associated only with stereotypes instead of being recognized as a condition affecting thinking, perception, and social interaction. People with somatic symptom disorders are commonly dismissed as having symptoms that are all in their head, leading people to dismiss the very real distress and functional limitations tied to those physical symptoms. Next category are chronic pain and fatigue conditions, which are routinely overlooked. And many people are unaware that depending on those limitations imposed can be disabilities. Some of these conditions include complex regional pain syndrome, primary visceral pain syndrome, and fibromyalgia, which is not only a chronic pain condition, but it can also include trouble concentrating, headaches, and migraines, and other sensitivities to light and sound. Autoimmune conditions are another area that are, while non apparent much of the time, can be overlooked in the context of the ADA and disability. However, an estimated 8% of the US population has an autoimmune condition. A very basic way to understand conditions in this category is to think about someone's immune system mistakenly attacking healthy working parts of the body and then damaging them as a result. Many of these conditions are chronic and often debilitating. Individuals with autoimmune disorders often experience ableist aggressions that those with non apparent disabilities experience because many of these conditions have no outward or obvious indicators that someone has the condition at all. Communication processing conditions that includes areas of speech, language, and auditory processing affect approximately 40 million Americans, or just about 12%, making it among the most common disability categories. Communication processing conditions can include a wide range of conditions that have significant impacts on an individual's personal, academic, and professional lives. Reproductive health conditions, such as endometriosis, affect about 10% of reproductive age women and girls globally. There's also other reproductive system related conditions like PCOS, certain reproductive system cancers, and prostate cancers as well. So now we're going to spend a little time on each category by providing background on one or two of the medical conditions in each of the groups that perhaps is less often identified as being a potential disability or one that was historically stigmatized or overlooked. As I mentioned earlier, ADHD is often misunderstood or overlooked, but it affects about 15.5 million adults in the US as of 2023. However, more than half, about almost 56%, aren't diagnosed until adulthood, which means many people go years without support. Even after diagnosis, only 1 in 3 report taking medication, and over 70% of individuals in this category have struggled to access medication due to long-term shortages. In the workplace specifically, the gap is just as striking. Only 30 to 40% of employees with ADHD receive accommodations. The numbers show us that while the condition is common, the support systems around it are still limited. Raising awareness is critical for equity and inclusion. So in the workplace, ADHD can show up in several ways. There can be challenges with time management, organization, and prioritizing work, which can lead to missed deadlines or even messy workspaces. There could be difficulties with sustained focus, which may cause lateness to meetings, disorganized presentations, or unclear communication. Impulsive communication and low frustration tolerance can also impact relationships, especially when managing stress or receiving feedback. These behaviors reflect how ADHD affects attention, regulation, and executive functioning. Employees with ADHD can benefit from quite a wide range of tools that support organization, like calendars, written instructions, and flexible deadlines. Additionally, frequent accommodations include quiet workspaces, noise reduction strategies, and movement breaks to help reduce distractions and manage restlessness. Providing timely feedback reinforces progress and can help employees in this category stay on track. Migraines and cluster headaches. Migraines impact about 12% of US adults, especially those between the ages of 18 and 44, which are peak working years. They're one of the top causes of disability worldwide and often overlap with conditions like depression and anxiety, making daily functioning even harder. Cluster headaches, while less common, are incredibly debilitating during attacks because of the severe pain and frequency. Some limitations experienced in the workplace can include difficulty concentrating, sensory sensitivity, fatigue, and nausea. They can also manifest as frequent absences, clerical mistakes, missed deadlines, and difficulty in loud, bright, or fragrant environments. Making small adjustments to the work environment can make a big difference, reducing absences and making the workplace more accessible. For example, dimmable lighting or access to a quiet space when symptoms flare up can really help. Flexible scheduling, remote work options, or even extra breaks can help employees stay productive during and after a flare. Tools like written reminders, ergonomic setups, and deadline flexibility help maintain focus during and after migraine episodes. Turning to what I'd consider to be one of the most overlooked and stigmatized potential disability categories, are alcohol and substance use disorders, or sometimes referred to as SUDS. It is estimated that about 9% or 1 in 11 US workers has an SUD, and that 3/4 of those with a substance use disorder in the workplace have an alcohol use disorder. Additionally, 35% of US adults with a mental health condition have a substance use disorder, but only about 1% of those individuals receive treatment annually. Some commonly occurring conditions with a substance use disorder include anxiety, mood disorders like depression and bipolar disorder, ADHD, and personality disorders. The ADA does cover substance use and alcohol use disorders, but there are a few important distinctions. Individuals with a history of addiction or those currently in recovery are protected from discrimination and may be eligible for accommodations. For alcohol use disorders, the ADA recognizes alcoholism as a disability, though employers can still enforce conduct and performance standards. For substance use disorders, the ADA protects those who are no longer engaging in illegal drug use and are in treatment or recovery, but it doesn't protect current legal drug use. The differences highlight the ADA's balance between supporting recovery and maintaining safe, productive workplaces. Employees with substance use disorders may struggle with attendance due to treatment needs or health symptoms, and they may experience difficulty concentrating, meeting deadlines, or managing tasks consistently. They may also experience interpersonal challenges like irritability or frustration that can also affect teamwork. On top of that, stigma often discourages people from disclosing their condition or seeking support. So some potential accommodations are flexible scheduling and leave, which can support treatment and recovery needs. Written instructions, reminders, and adjusted workloads on a limited basis can help with focus and organization. In some cases, providing a quieter workspace may be useful. Access to employee assistance programs and supportive policies can also make a big difference in supporting employees with substance use disorders. So turning to fibromyalgia, it's a complex condition marked by widespread and often severe pain. It affects only about 2% of US adults, but most commonly those are women who make up between 70 and 90% of those diagnosed. It frequently occurs alongside other conditions like lupus or rheumatoid arthritis and can make management of those conditions even more challenging. Research shows that stressful childhood experiences, traumatic events, car accidents, as well as post-traumatic stress disorder can increase the likelihood of developing fibromyalgia, highlighting how both physical and emotional factors can play a role in its onset. Fibromyalgia can create limitations due to pain, cognitive difficulties, sleep disturbances, and sensory sensitivities. In the workplace, this can present as an inability to focus or maintain concentration, sometimes known as fibrofog or slowed thinking. It can also include negative impacts on collaboration and communication with colleagues due to the emotional and mental health strain caused by the condition. Employees with fibromyalgia may benefit from a variety of accommodations that help manage pain, fatigue, and sensory sensitivities. Environmental changes like alternative lighting, sun stimulating lamps, cubicle dividers, and noise canceling headphones can reduce strain and distractions. Flexible scheduling and remote work options are especially helpful during symptom flares. Ergonomic equipment such as adjustable chairs and anti-fatigue mats can ease physical discomfort, while modified break schedules allow for needed rest. Finally, using low odor or no odor cleaning products and air purifiers can minimize sensitivities that might trigger those symptoms. Several gastrointestinal conditions significantly affect people in the United States. IBS, or irritable bowel syndrome, impacts about 25 to 45 million people in the US, which is about 5% of the total population. And women make up 2/3 of those affected. Crohn's disease, one of the major forms of an inflammatory bowel disease, affects around 500,000 Americans and is considered part of a broader trend of rising irritable bowel disorder prevalences. Celiac disease is also widespread, with over 3 million Americans impacted, though many go years before receiving a correct diagnosis. Together, these conditions illustrate just how common yet misunderstood digestive disorders are and how important awareness and support remain. Some limitations that overlap these conditions include pain and bloating, unpredictable bowel symptoms, fatigue and brain fog, as well as anxiety and stress. These can present as frequent needs for restroom breaks, being late to work or meetings, difficulty enduring long meetings, and reduced productivity. Workplace accommodations for these conditions, like office locations with close proximity to restrooms, modified or flexible break schedules, and deadline flexibility, can be critical in ensuring employees have the tools needed to be successful in their roles. Aphasia affects about 2 million people in the United States, with about 180,000 new cases each year, most often following a stroke. In fact, nearly 1 in 3 stroke survivors experience some form of aphasia. Anomic aphasia is one of the most common and milder types, where individuals can speak fluently but can struggle with word retrieval, especially naming objects. While exact numbers for anomic aphasia are harder to pinpoint, it represents a significant portion of aphasia cases, making awareness and supports critically important. In the workplace, anomic aphasia often can show up as a difficulty with word finding during conversations, meetings, or presentations. Employees may rely on vague terms, pause frequently, or take longer to write emails and reports, which can sometimes be mistaken for a lack of knowledge or preparation. These challenges can also create stress and a reluctance to participate in group discussions or interactions. It's important to remember that the limitation is in accessing language, not in intelligence or ability. Employees with anomic aphasia often benefit from accommodations that can make communication more accessible and less pressured. So, allowing extra response time in meetings gives them space to find the right words. Providing written materials ahead of time, like agendas, instructions, key questions, can help with preparation. And using multiple modes of communication, such as follow ups in writing, chat, or visual aids, ensures that information is clear. Meeting transcripts and captions can support comprehension, and simple clarification questions that allow for a yes or no answer can make participation easier. Endometriosis affects about 11% of women in the US, so about 6.5 million people and nearly 190 million individuals worldwide. Despite how common it is, diagnosis often takes 7 to 10 years after symptoms begin. The condition is marked by chronic pelvic pain, painful and heavy periods, and in many cases, infertility. Beyond physical symptoms, endometriosis often brings significant emotional and mental health impacts, with higher rates of depression and anxiety. It can also disrupt careers and daily life, leading to reduced productivity, increased sick leave, and tough choices about work and family planning. Some limitations of endometriosis in the workplace include chronic pain, fatigue, and unpredictable flares. making it hard to maintain consistent attendance or stay fully focused during the day. Employees may need frequent breaks, flexible scheduling, or time away for medical care. The symptoms can also reduce productivity and limit participation in physically demanding tasks. Importantly, many people don't disclose the condition due to stigma, which means the impact may not always be apparent, but it is very real. As an aside, endometriosis is considered both as an autoimmune condition and reproductive condition. Endometriosis can create those significant challenges in the workplace, like the severe pain, fatigue, and poor sleep, which can lead to those unpredictable flares. And the stress of managing ongoing symptoms can contribute to that anxiety and depression. These factors may increase the need for additional breaks at times or the need to flex schedule or provide remote work days during flares. In some cases, employees may need extra restroom breaks or extended time away to manage their symptoms. For historically stigmatized and less common conditions like alcohol use disorder and mental health conditions, stigma often shows up in the words that we use. In the workplace, this stigma can discourage people from requesting the accommodations they may need. So let's take a few minutes to discuss how to discuss these conditions both in everyday life and in the workplace to increase inclusion and reduce stigmatization for those that may need to request assistance or accommodations. When speaking about individuals with disabilities, we really want to avoid language with negative overtones, like a stroke victim, or afflicted with, or suffering from. We also want to be sure that we aren't using outdated language like wheelchair bound, or homebound, or bed bound. We also want to avoid language regarded as slurs and also language that assumes knowledge about an individual's experience because you might know someone with, or you also have a family member with. It's also important to keep in mind this disability and disabled are not bad words. Challenge yourself to remove words and characterizations that may be offensive to others. There is no reason to use differently abled or specially abled. Pay attention to how someone refers to themselves and follow their lead. And acknowledge that language evolves over time. Stigma around mental health has seeped into the way we talk, often without realizing it. Words like crazy, OCD, or bipolar are used casually in workplaces to describe people or situations, but they reduce real mental health conditions to stereotypes. This kind of language can make employees feel dismissed or unsafe about sharing their experiences. The good news is we can reframe our words by focusing on behaviors or experiences rather than labels. Saying someone's overwhelmed instead of crazy, or that a task was stressful instead of saying that it gave you PTSD, creates a more respectful and inclusive environment. Stigma around substance use disorder often comes from careless language like addict, junkie, or alcoholic, and reduce persons to their condition. NIDA recommends using person first, medically accurate, non stigmatizing language. For example, a person with a substance use disorder or a person in recovery. So we have a few additional items here on the slide. We want to try to avoid calling something a problem, so an alcohol problem. We don't want to discuss individuals as either being clean or dirty due to their toxicology results. We want to really be sure that we are utilizing inclusive language like substance use disorders or a person with a substance use disorder, talking about unhealthy or heavy use of a particular substance. Ableist idioms are often slipped into language without us realizing it. Sayings like fall on deaf ears or not having a leg to stand on use disability as a metaphor for weakness or failure. While these phrases are ingrained in culture, they can reinforce negative stereotypes and send a subtle message that people with disabilities don't belong. It's especially important when we consider that the majority of disabilities are non apparent, things we can't always discern, which means you may be using these phrases next to someone with a disability or who has a family member, spouse, a close friend, a coworker with that disability. So, to create an inclusive environment for everyone, be sure you consider how your words may impact others. So, we want to avoid things like that's lame. Why? Because it was originally derogatory towards people with mobility disabilities. Using that's dumb, stupid, or idiotic was historically used to describe people with intellectual disabilities. Saying, are you blind? To mean someone missed something obvious equates visual impairment with incompetence. When we talk about falling on deaf ears, it frames deafness as ignorance or an unwillingness to listen. And not a leg to stand on equates not having a limb with being weak, powerless, or lacking credibility when we're talking about a conversation or an argument. So before we wrap up, there are just a few key takeaways to consider. Inclusion really starts with our culture. Supervisors and colleagues can avoid assumptions, provide flexibility, and respect confidentiality. Even small adjustments in process and policies can make a big difference. And remember, there is no exhaustive list of disabilities, which means we never truly know who in the room may be living with a disability. It's also why it's so important to check in with employees, since needs may change over time, and be ready to answer questions about schedules or situations in a way that protects privacy. More importantly, approach every request with empathy rather than judgment. That's how we build workplaces where everyone feels respected and supported. So that is the end of the presentation. Thank you very much.